Hello, the smartest 10-minute daily investment to extend your health span. This is Vibrant Midlife. I'm David.
Hi, I'm your health mate, Emily. I'll help you regain your vitality with a 10-minute investment.
Emily, one of the biggest health concerns for middle-aged people is blood pressure, right? Many people worry about starting blood pressure medication because once you start, you have to take it for life. Is there a special way to lower blood pressure without medication?
Absolutely. Beyond walking and low-salt diets that everyone knows about, today I'll introduce you to a very simple yet powerful lifestyle habit that even doctors are paying attention to based on the latest research results. Today's episode title is The Habit That Surprises Even Doctors: How to Lower Blood Pressure Without Medication.
A habit that surprises even doctors. I'm really curious. Is it more effective than walking or reducing salt?
According to a large-scale study published in the British medical journal BMJ, there's an exercise that can be more effective at lowering blood pressure than aerobic exercises like walking or running. And that exercise is this.
What on earth is it?
It's isometric exercises, or as we commonly know it, static hold exercises.
Static hold exercises. You mean like planks or wall squats? How can something that doesn't even move lower blood pressure?
That's exactly where the magic happens. The scientific principle is very simple. When we hold positions like planks with maximum force, our muscles temporarily compress the blood vessels tightly.
Right, like blocking the blood flow.
Exactly. Then, when we suddenly release the tension, what happens? Blood flows powerfully through the narrowed blood vessels, right? At that moment, the blood vessel walls are stimulated and secrete large amounts of a substance called nitric oxide.
Nitric oxide. That's the same component we talked about in episode 18, blood vessel cleaning juice.
That's right. That nitric oxide is the best natural blood pressure medication that makes our blood vessels smooth and elastic. Static hold exercises have been proven to be one of the most effective ways to promote nitric oxide secretion.
Wow, it's such an incredible principle hidden in just holding still. So this must be today's 10-minute point, the most effective blood pressure management static hold exercise we can start today.
Yes, it's the invisible chair pose or wall squat. Lean your back comfortably against the wall and slowly lower your body until your knees are at 90 degrees, like sitting on an invisible chair.
The posture seems simple. How long should I hold it?
The routine proven most effective in research is this: hold for 2 minutes, rest for 2 minutes. Repeat this 4 times total. Even just 3 times a week can bring amazing blood pressure lowering effects.
2 minutes hold, 2 minutes rest, 4 sets. I could do this while watching TV.
Absolutely. However, there's a very important precaution. You must never hold your breath while tensing and holding. Holding your breath can actually cause blood pressure to spike dramatically. You must maintain comfortable, deep breathing. Inhale through your nose and exhale through your mouth continuously.
Let me summarize. Not only aerobic exercises like running or walking, but static hold exercises like wall squat, done consistently 3 times a week, can greatly help lower blood pressure without medication.
Perfect summary. Of course, if you're already taking blood pressure medication, you must consult your doctor and adjust the exercise intensity. Add this static hold exercise to your healthy lifestyle habits list starting today.
But Emily, are there other static hold exercises? Are there effective exercises besides wall squat?
Great question. Of course there are. Besides wall squat, there are several effective isometric exercises. First, there's plank. It's the position where you support your body with your elbows and toes, and this exercise is also very effective for lowering blood pressure.
Plank. How long should I hold it?
For plank, start with 30 seconds and gradually increase. But goal is to hold for 2 minutes. Like wall squat, repeat 2 minutes hold and 2 minutes rest 4 times.
So which is better between wall squat and plank?
It depends on the individual. People with knee problems are better suited for plank, and people with back problems are safer with wall squat. Alternating between the two exercises is also a good method.
I see. But are there other precautions when doing these exercises?
Yes, there are several important precautions. First, never overdo it. Start with 30 seconds and gradually increase. Second, if you feel pain during exercise, stop immediately. Third, people with severe hypertension must consult a doctor before starting.
When is the best time to do these exercises? Is it better in the morning or evening?
For blood pressure management, morning is more effective. Morning exercise helps maintain stable blood pressure throughout the day. But you can do it according to your personal lifestyle pattern. The important thing is consistency.
But is this exercise alone sufficient? Don't we need to improve other lifestyle habits too?
Of course, isometric exercises are very effective, but combining them with other lifestyle habits can bring even better results. Low-salt diet, regular sleep, stress management, quitting smoking, all are important. Especially reducing salt intake is the foundation of blood pressure management.
How long do I need to do this exercise to see effects?
According to research, doing it 3 times a week for about 8 weeks consistently can show blood pressure lowering effects. Systolic blood pressure decreases by an average of 8 to 10 millimeters of mercury, and diastolic blood pressure decreases by 4 to 6 millimeters of mercury. But since there are individual differences, it's good to check regularly with a blood pressure monitor.
Wow, even specific numbers. But can blood pressure actually rise while doing these exercises?
Yes, it can happen. Especially when starting or doing too much, blood pressure can temporarily rise. So it's important to start with short durations and maintain proper breathing. If blood pressure continues to rise, stop exercising and consult a doctor.
What should I check before starting these exercises?
There are several checkpoints. First, check your current blood pressure. Second, check if you have any problems with joints or back. Third, if you have heart disease or other chronic conditions, definitely consult a doctor. Safety comes first.
Thank you for the detailed explanation. What changes might I feel while doing these exercises?
You can feel several positive changes. First, as blood pressure stabilizes, headaches and dizziness decrease. Second, as muscle strength improves, daily life becomes more comfortable. Third, there's a stress relief effect, so your mood improves. Fourth, sleep quality often improves.
Can I reduce medication if I do these exercises consistently?
That must be decided after consulting a doctor. If blood pressure improves through exercise, medication dosage can sometimes be adjusted, but suddenly stopping medication can be dangerous. Your doctor will check blood pressure regularly and adjust gradually.
This was really informative. Are there cases where people fail with these exercises?
Yes, of course there are. The most common causes of failure are, first, giving up too quickly. You need to be consistent for at least 4 to 8 weeks to see effects. Second, overdoing it. Trying to hold for 2 minutes from the start will make you tired quickly and give up. Third, not breathing properly. Holding your breath can actually raise blood pressure.
Is there a secret to success?
Yes, there are secrets to success. First, start with small goals. Start with 30 seconds and gradually increase. Second, do it at regular times. It's important to set a fixed time in the morning or evening and make it a habit. Third, do it with family or friends. Encouraging each other makes it more fun and helps you stay consistent. Fourth, record your blood pressure. Seeing the effects directly makes you work harder.
These are really practical tips. Are there symptoms I should watch out for while doing these exercises?
Yes, there are several symptoms to watch out for. First, if you feel severe dizziness or headache, stop immediately. Second, if you feel chest pain or difficulty breathing, go to the hospital. Third, if you feel severe pain in joints or muscles, stop exercising and rest. Fourth, if blood pressure rises dramatically, consult a doctor.
It's really important to exercise safely. Are there foods that are good to eat while doing these exercises?
Yes, there are foods that help with blood pressure management. First, potassium-rich foods like bananas or avocados are good. Second, magnesium-rich nuts or green vegetables also help. Third, omega-3 rich fish is good for vascular health. Fourth, nitrate-rich foods like beets or pomegranates also help lower blood pressure.
What should I do after exercise?
There are several important things after exercise. First, get enough rest. You must observe the 2-minute rest periods. Second, drink plenty of water. Since you sweat during exercise, hydration is important. Third, do stretching. Relaxing muscles can reduce soreness the next day. Fourth, check your blood pressure. You can confirm the exercise effects.
Thank you for this systematic explanation. Are there things I should avoid while doing these exercises?
Yes, there are things to avoid. First, holding your breath. This can cause blood pressure to spike dramatically. Second, overdoing it. Trying to hold for too long from the start will make you tired quickly and give up. Third, doing it right after meals. It can interfere with digestion. Fourth, doing it after drinking alcohol. There's a